Hi, my name is Yafa Serur. I'm a child and adolescent psychiatrist working in Israel. I'm going to share with you the results of a study that we conducted at Sheba Medical Center, part of Tel Aviv University. So the name of our study is Psychiatric Disorders and Autism in Young Children with 22q 11.2 deletion syndrome compared to children with idiopathic autism. So many parents of children with 22q recognize some kind of problem in the way their children communicate with other kids, but not only the way they speak, but the way they socialize, relate, play, and understand and express themselves. We know that children with genetic syndrome have a higher risk for social and communication problems, and some of them are diagnosed with autism spectrum disorder. Previous studies examined the rate of autism in people with 22q, but until now, there were no studies that examined the rate of autism in a young age, like preschool. It is important to diagnose autism as early as possible, as there are some effective treatments for autism when initiated at a young age. We studied children with 22q from 3 to 8 years old and compare them to children with idiopathic autism. Idiopathic autism is the children that are diagnosed with autism, but they have not a known genetic syndrome. So what we find, 16% of children with 22q were diagnosed with autism. That is higher than the population without the syndrome, but not so high like other syndromes such as Fragile X. Even when diagnosed with autism, the social and communication problems in the children that have 22q were less severe than in children with idiopathic autism. In addition, we found that high proportion of children with 22q fulfill the diagnosis criteria of other psychiatric disorders. The most common psychiatric disorders were ADHD, anxiety disorders, and elimination disorders, that is, problems with winning. In conclusion, it is important to all parents of children with 22q to be aware of psychiatric symptoms like trouble with communication and socialization, problems to concentrate, problems to remain seated, and also anxiety symptoms. And we recommend to all parents to take their children to a psychiatric assessment from preschool years so they can be diagnosed and treated as early as possible. Thank you very much.